The World Health Organization says human metapneumovirus was first identified in 2001, and it's been circulating among people for some time. Symptoms are similar to a common cold, and researchers say the infection is typically mild and resolves on its own. While case counts are currently spiking in China, Dr. Margaret Harris from the WHO says there is no cause for alarm.
China's reported levels of respiratory infections are within the normal range. It's what we expect to see for the winter season. Authorities report that hospital utilization is currently lower than this time last year, and there have been no emergency declarations.
Infectious disease researcher Matthew Miller says the reason behind the surge is not entirely clear.
But I think most experts feel that it's just an unusually severe peak of a virus that we see on an annual basis.
Miller says the risk in Canada is relatively low.
In Canada, we do monitor and report on the proportion of human metapneumovirus cases that occurs annually. And right now, our case numbers are relatively low, much lower, for example, than COVID-19 or influenza or even RSV at the moment.
But any respiratory virus can lead to bacterial infections like pneumonia. Public health advice is to see a doctor if a viral infection doesn't improve after 10 days, or if you start to improve and then unexpectedly get worse.
Because the virus has created an environment in the lung that makes it easier for bacteria to infect you. And then those bacteria can make the disease even more severe, but can also often be treated effectively with antibiotics.
Because this virus is spread through close contact with someone who is infected, hand washing, wearing a mask, and staying home if you're sick are the best lines of defense. Katherine Ward, Global News.